And earlier in the bulletin, we brought you an update on the decision of the World Health Organization to declare the Mpox outbreak a public health emergency of international concern. We are now being joined by Professor Abdusalam Nasidi, the Pioneer Director General of the Nigerian Center for Disease Control and Prevention, to discuss the WHO's global warning on Mpox and its reported outbreak. Good to have you here. So thank you so much for joining me here on Newsday.
Thank you for having me.
So we're hearing quite a lot about this Mpox virus, and many are worried and alert. Could you shed more light on the causes of the disease and anything else that might be of crucial interest to Nigerians at this time?
Well, thank you. The key is the fact that the disease is not new. It's been there before. It was detected for the first time in Denmark in 1958 in experimental monkeys. The first human case was reported in the Democratic Republic of Congo in the year 1970. From that time till now, the disease has been occurring either in sporadic or epidemic proportions in and around Congo and East African countries. But it spread to West Africa, and the virus that causes this disease is called the monkeypox virus. It's actually related to other similar viruses like the cowpox virus, the smallpox virus, and these are all, vaccinia virus. But before now, it was not really causing any attention. In fact, it was included among the neglected tropical diseases by the WHO. But with the advent of this new resurgence that we are seeing in the last 4 to 5 years, it's becoming frightening that a virus that jumped from an animal, to human, is now gaining potential to spread faster, more efficient, and to even cause severe disease and deaths. So with this type of trend, a virus that is similar to smallpox virus definitely will frighten the world to make sure that we are not taken by surprise by this virus. The recent resurgence in the Congo Democratic Republic and the neighboring states of Rwanda, Burundi, and all those countries around that area shows that in less than 6 months, almost 106% increase in cases, with mostly children affected and high mortality, for that type of disease. So with the potential to spread, among, the vulnerable in particular, further frightens or the governments of these areas. But there was information, news is that unlike before, when most of the route of transmission was just through close contact with person who is carrying the virus or who is sick, now we have very new route and strong route of transmission, which is the sexual transmission of this virus. May I say that the first evidence for this, for the sexual transmission of the virus was actually detected by a Nigerian professor here in the world. And his name is Dimie Ogoina, professor. He's now the provost of the Niger Delta University. He did fundamental work, and because of his work, he became one of the 100 most important people in the world, according to Times Magazine for 2023. So as soon as he reported that sexual transmission, many other countries started seeing them, including in Europe and the US, but the worst is the recent resurgence in Congo that shows a new clade that is really transmissible, efficiently through sexual contact. The virus, we know, is divided into two groups or clades, clade 1, and then which is usually transmitted through the normal routine contact, and then the clade 2 that is now transmitting efficiently through sexual route. But the last few weeks, the one that is causing the outbreak is clade 1B, which never was never seen to be transmitted sexually. So this route is frightening, and the fact that it's affecting and killing mostly those who are vulnerable, HIV positives, hungry, those who are in refugee camps, and so on. So I think is really worrying.
Frightening and worrying indeed. But just as we saw the resurgence within Central Africa, are there any particular states within Nigeria that are more susceptible than others? And if so, could you tell us?
Well, at the beginning of the event of this virus in Nigeria, it was detected mostly in the southern states, Bayelsa, Ogun, Lagos, some southeast states and so on and so forth. But now it has spread to 33 states, and it's very difficult to say which state is more sensitive to the virus or not. We can just generalize to say most of the cases that are seen so far are in the southern part.
And with the federal government, they're doing as much as they can. They have released statements saying that they've intensified monitoring and screening procedures at all of our entry points into the country. They've also implemented a new mandate requiring travelers to complete an online health form before entering the country. Is there more that should be done? We do know that during the COVID times, there was a whole uproar about allowing countries that had large amounts of these cases come into other countries, particularly African countries flying to the West when the Omicron variation came about. Do you think there should be more scrutiny on flights in and out of these countries that are highly infected, if possible, even like a cessation of flights, or is that too severe?
Well, I will say definitely there's need to increase our level of alertness, and that's why the WHO, the African CDC first on the 13th declared it a public health emergency of international concern, and then a day later, WHO, followed and saw that that definitely the disease is a very fast spreading. So. This means that all countries have to be involved. The declaration of public health emergency of international concern means it can never be left to one single country anymore to control it. There must be an international coordinated effort. Now, every country must report, every country must share information, share data, and make sure that the response is coordinated. If not, the virus will escape. And if it escapes, it can be more global and more devastating. So, to declare, public health emergency of international concern, there should be an extraordinary, event which already is confirmed that, the virus is behaving very strangely and spreading efficiently. Then there should be confirmed public health risks. That already has been confirmed, that is now affecting populations that are not known to be affected before. And then, of course, the last one is, this international coordination that except it is done, it won't work. For instance, in Burundi, when it jumped from DRC Congo to Burundi, within a short period of time, 50% of the counties of Burundi are already reporting cases with deaths. So, which means if the virus, gains more potential, reassaults or mutates further, it can either be weaker or stronger than we are seeing it to be now. So that means there will be enhanced surveillance, proactive surveillance, but there won't be necessary need to restrict movements, because it's not like COVID, is transmitted through contact, close contact, through sexual contact. And so if you can, implement effective proactive surveillance, you can actually, limit its spread and mitigate its impact.
And is there a vaccine for this virus?
Yes, fortunately and unfortunately, there's a new vaccine that was developed, and in the view of the fact that the threat was becoming higher, they gave it emergency use authorization to use the vaccine even without all those WHO and FDA or NAFDAC requirements for very detailed clinical trial. So the vaccine was used in areas, in Europe and other developed world where they found cases in a ring vaccination manner. That means you have a case, you immunize everybody around it. So it was very effective. It neutralized, the further spread of the disease. But what happened to Africa was unfortunate. Where the disease is endemic and so on and so forth, we could not gain access to that vaccine as we should have. It is the countries that are not endemic, got it sporadically, that had the vaccines, and they did not release it to Africa. When we face the WHO and others, why is it that we are the ones that have the disease, and now there is the vaccine and we do not have access? What we were told was that, we did not make necessary demands, to get the vaccine to be released. For instance, now, Nigeria with 220 million population, will be proud to receive only 10,000 vaccines, doses of vaccine. So you can imagine if we are not self-sufficient in these products, we shall be in trouble, from time to time. We should now, this is the time to look inwards and start creating and establishing vaccine manufacturing, drug manufacturing plants, and liberate ourselves.
And what lessons could we learn from the years of the COVID pandemic to apply to make this Mpox scare something that is more contained and not a global phenomenon?
Well, I think Nigeria has shown an example on how to respond, right from the Ebola response, the COVID response. We have done so well. Nigerian Center for Disease Control has excelled to the extent that even some of the leaders of the developed countries say, go and learn from Nigerian CDC. So Nigerian CDC has a lot of, background, experience. We have so many tools and the mechanisms that were put in place to fight Ebola, to fight COVID, which can be repurposed now and prepare the country to fight this virus in case it does come in and start spreading. The good news is, at least so far, the strong surveillance system that the NCDC has, they are closely monitoring the virus causing the disease currently, which is declared 2, I think, and they are doing genomic sequencing right here in Abuja. They have it in Lagos and Kano, and so we have the capacity to be able to track the virus and make sure that it doesn't escape.
And just for individuals who might not be in the know or haven't been tuning into any major news channels in the last couple of days, can you give us an idea of exactly how Mpox manifests itself, what the symptoms are, and exactly the means of treatment, and what individuals should do if they do suspect that they have contracted the virus?
Well, it is usually, the normal symptoms, or the usual, I won't say normal, the usual symptoms we see with other infectious diseases, particularly viral infections. It starts with fever, severe headache, muscle pain, and, back pain, and general weakness, very severe weakness. This phase is called the invasive phase. That is the time the virus is spreading in your body, weakening you, and then the second phase is called the rashes phase. That is when somebody will start seeing rashes initially either in the back or the extremities and etc. Then it will start spreading. It will grow and become a pustule. It will contain fluid and pus, and then it will burst. So, but very strange, well, I would say strange, it's characteristic for the pox viruses. The rashes will appear everywhere. Most other diseases that it mimics, like syphilis, like measles, like so many other diseases, you don't see rashes on the palm, you don't see rashes on the sole, you don't see rashes in the mouth. But this particular last one that is spreading sexually, you see very painful rashes around the anal and the genital areas, and in the mouth, around the mouth. So this is at that stage already. The patient will be feeling really sick, and if the virus overpowers his immunity, they die.
It is some truly graphic images that have been showing about the way that Mpox manifests itself. Is there any possible way to cure? Very briefly, is there a way to completely recover from Mpox, or does it stay in the system for life?
No, to recover from the disease, many have been recovering. The death rate of the current, resurging illness is 20%. And there are drugs, antiviral drugs, that are used to limit the the viral load of the virus at the early stages. So they could be working, but unfortunately, this the latest clade causing this outbreak seems to be a little bit stubborn. But there are drugs, and also there are other diseases that accompany this Mpox, because it weakens your body immediately. So any other underlying disease that is there before will follow. So the treatment will be treat all the other accompanying disease, and then use the viral drugs to reduce the viral load in the person affected.
Well, Professor Abdusalam Nasidi, pioneer of the NCDC Director General, thank you so much for joining us and for giving us more helpful information on this Mpox virus. Thanks.